I am one of your hosts tonight. I'm with Cancer Connection Resource Center, along with Angela Ballard and Glenda Kuzar. Now, just to give you a little bit of background about us, Cancer Connection Resource Center, we actually started back in 2017. And what we primarily do, and I'll give you a little bit of a background on each one of us, so you'll understand where we're all coming from. What we wanted to do when we all came together with our executive director, and you will meet her shortly, Glenda Kuzar. She pulled us together because she found a need and a cry in the industry of at Washington Hospital Center in the cancer unit that she has worked in. I have a finance background. I have an MBA in International Finance. I've done financial literacy in school. I've done mortgage. I've done real estate. Currently, I'm a grant and loan specialist now with HUD. Angela Ballard, she has a BS in biology. She has done clinical research, cancer research, rehabilitation. She's currently has gone out and she does physical therapy now, massage therapy to even try to help some of the people that have been stricken with this disease. She also, I want to add, she makes these wonderful butters. I use them every day. She makes
Yeah.
these wonderful butters for your skin. It also helps inflammation and it helps some of the people that have gone through a treatment at the Cancer Institute. What we are trying to do, um, well, I'm going to leave Glenda for last. What we are trying to do is we saw the need out there for people that just did not have access to a lot of resources. So that's why we call ourselves Cancer Connection Resource. So we do things which were small things, but it turned out to be a magnitude to the people that we help. We do things like home cleaning, um, rides to appointments, help pay with some co-pays. We have psychotherapy. We have somebody on call that if someone needs help. Glenda, of course, she's a navigational nurse. Angela will provide some massage therapy, some of her treatments, some of her butters the creams that she makes. Um, we also we work with adults over the age of 18. And one thing about our organization is we work with all types of cancers, with men and women and all types of cancers. One of the things that I do is the financial aspect is when they are done with treatment, active treatment. That's when we help people when they're in active treatment. When they are done with the treatment, if they need to get back on financial track and they need someone to help them navigate or mitigate some of their financial stress that they have, they will then at that point they will come to me, and with the help and grace of God, I'll be able to look at their profile and be able to help them get back on track and give them some advice and some solutions on getting on track. Now, our executive and CEO of this organization is Glenda Kuzar. And most of you probably already know her. She's a wonderful person. She has a BS in nursing. She's been in the industry over 30 years. She does things with the American Cancer Society. She goes around the country. She gives seminars. She hooks up with people. And she's actually the one where we get a lot of the patients from, because she's in the midst of it all and she hears it all and she knows it all. And so when she heard this cry back in 2017, she wanted to bring together some like-minded individuals that can help in each different facets of what it is that we're doing so that we can try to help some people mitigate and, as she does, navigate through this terrain. So you can absolutely imagine things that we have tried to do. We even have a church in Philadelphia that every year their trustee board, they sponsor two families. And that has been just magnificent, with the gifts and the food. And, when we have our fundraisers, we reach out to you. We're using that to make sure that they can have food on the table and with all the help that they need. So what I'm going to do now, because this, again, is this brainchild of Glenda Kuzar, we decided to have this healthcare checkup, especially talking about insurance. So now, without further ado, I would like to introduce you to our founder and CEO, Glenda Kuzar.
Well, thank you, Barbara, for that wonderful introduction. Good evening, everybody. Yes. And just want to thank you for coming to our webinar. We don't take it for granted, so we just want to say thank you. Barbara Grant did a phenomenal job with the introduction, and she shared, the purpose of our organization. So Barbara, thank you so much. And like she said, and I'll just piggyback, we definitely like to do navigation, and we like to provide educational and financial resources to a lot of patients with the diagnosis of cancer. And donations are welcome because they will go to good use. We have been able to help a lot of people. Just this past week, we have been able to help 5 patients, giving them $100 gift cards because they didn't have any food and they're in active treatment. So I just want you to know that every donation that you make, it does go to good use. And again, for this evening, we have a phenomenal speaker, and we just want everyone to know, even though our organization, our target audience that we help are cancer patients going through chemotherapy. This seminar or symposium is for everybody's general information, because I have realized working, as a nurse, so many people really do not know what their coverage is about. They really don't know the prescription coverage. They don't know what their insurance covers. And many of us are knocking on Medicare's door, me included, and we don't really know exactly what is the process. So this is a good time just to get this information, especially with everything that is occurring in our country right now. We can use this information more than ever. So at this time, I am going to introduce our speaker, and her name is Kaliesha Johnson. Sorry, I'm on the phone, right? Now, before I introduce Kaliesha, Barbara, did you want Angela to say something?
Of course, if Angie would like to say something, Angie can say something.
This is our other. Or you know what? I think she did say she would save hers to the end. I forgot that. Yes.
She'll
Okay,
close it
so
out.
yeah. And then also, I was going to say, for our guests, if you would like to come off, if you would like to turn your camera on, you can do that. But it's not required. We just want you to be comfortable and just sit back, relax, and soak up all of this wonderful information that you're going to receive. So at this time, I'm just going to give you a brief background of our phenomenal speaker. And her name is Kaliesha Johnson. She is our patient financial coordinator. She works at MedStar Washington Hospital Center in Washington, D.C. Actually, she is my colleague. She has over 20 years of experience advocating for cancer patients, and she's dedicated to easing the financial burdens that come with a cancer diagnosis. As a patient financial coordinator at MedStar Washington Hospital Center, she works closely with patients to navigate complex financial challenges, ensuring they can focus on their health rather than financial stress. Her expertise includes 12 years in specialty pharmacy and experience in multiple cancer centers, where she has assisted patients in securing financial aid through assistance programs, insurance applications, and Social Security benefits. In addition to all of that, she specialized in educating patients on their insurance benefits, providing clear explanations of coverage, out-of-pocket costs, and available financial resources. She also ensured patients understand their options. And by doing that, she's empowering them to make informed decisions about their care. Her ultimate goal is to help patients combat financial toxicity, ensuring they receive the care they need without unnecessary financial hardship. Every day, Kaliesha strives to be an advocate and resource for those fighting cancer, providing them with the financial guidance and support they deserve. I nicknamed Kaliesha a miracle worker. I think, was it last year or a year and a half, she was able to find $500,000 for a lot of our patients to help lessen the burden of financial toxicity. So we're just so appreciative and honored to have her as our speaker to share her wealth of knowledge. And at this time, passing the mic to the one and only Kaliesha Johnson, aka Miracle Worker.
Thank you, thank you, thank you, thank you so much. And thank you everybody for just showing up tonight and just for an informative speaking for tonight. I just hope that you guys grab something out of this today and don't hesitate on asking questions. I want to make this as informal as possible. So if you have a question, write it down, raise your hand, and can we raise a hand on Zoom? Sorry. Okay. But just we can either hold them to the end, or if it's burning, just unmute. Just thank you. She could raise her hand. Okay,
Yeah.
so we can just start at that. So I'm going to touch on a couple subjects tonight, and I know insurance is a big one. And so, couple agenda hitters today. We're going to go a little bit over insurance, a little bit over medical coverage, prescription coverage, commercial/private insurance. It has multiple names. A little bit of Medicare and Medicaid, because folks get those two confused a lot. And then also I wanted to finish up a little bit about if you're thinking about retiring, some key pointers that you might want to look into doing before you retire, so to make sure that you have the best coverage when you go into those limited aspects for income after that. Okay. So we want to start slideshow. We can start at, and we can go on to number 4. Can y'all see the slideshow? Yeah, because we passed a couple things. And I believe this will be available to you all later on. So I just do a brief statement up here about what insurance is, about the contractual agreement it is between an individual and a business owner or policy. So I just threw that out there just to start us off with, my icebreaker is what I call it. We can go on to the next slide. So these 3 types of insurances, although there are multiple types of insurances, I wanted to hit a couple pointers on these: medical insurance, prescription insurance, and supplemental insurance. So most of you know medical insurance as what you use when you go to see the doctor or go see specialists and things like that, or hospital. And also you have hospital insurance, which goes into that. But today my main focus is going to be prescription insurance, because of all of the different changes in prescription coverage we've been going on through the last few years. And this particular year, it's been a lot of big changes in insurance for prescription coverage, and assistance for prescription coverage, and then supplemental insurance. The supplemental insurance, most people call those like a Medigap. Plans have a lot of different names for it, right? So you get like you get excuse me, I get tongue tied. I'm not a big speaker. So you get 6 months to when you're getting ready to retire, we get ready to go into that Medicare stage and age. You have like some grace periods and things like that you want to touch on to. And so what they do is they give you like a 6-month gap period. And within that 6-month gap period, what they give you is where it's almost like buying life insurance. So with life insurance, when you have underlying health conditions and things like that, you can get denied for coverage. During this 6-month period, grace period, I call it, you can go, you can, excuse me, obtain an insurance policy for supplemental coverage without being penalized because you have an underlying condition, whether it's diabetes, whether it's cancer, whether it's asthma, any of these things. You have a grace period. So it's just very important to know when you're getting ready to go into a retirement and things like that, of what to do, of what to look for before you pick those particular plans. So I definitely recommend speaking with your HR rep, before going out on retirement, speaking with Medicare, speaking with Social Security, speaking with all of these entities before you go into that. And then we can circle back to retirement a little bit at the end. We can go on to the next one. Let me know if I'm going too fast. I'm a little nervous, y'all. I'm sorry. So, um, this is a big one, and I don't know if a lot of you, what age group or range of young ladies or men that we have in today, but Medicare Part D, which is the prescription drug coverage of Medicare, has a lot of changes, and it had a lot of changes this year. So it's called Medicare drug coverage, also known as Medicare D. This helps with Medicare prescription with, excuse me, this is for your prescription coverage for prescriptions at the pharmacy. This could be either a medical plan. You could have the all-inclusive plan where your prescriptions come out. Thank you. Thank you. Um, with your prescription plans come out, or you can have a separate Medicare prescription drug plan that's separate. Or you might have a commercial plan that has pharmacy benefits through it. Commercial plans and the Medicare or the federally funded plans have different benefits from them. Like for a commercial plan or private insurance through your work or through Marketplace, you could probably use manufacturer coupons and things like that to help lower your costs for your prescriptions on a day-to-day basis. Whereas the federal government plans, they are a little different where you're stuck with a large out-of-pocket at times. And so what I want to do is show you this video, this quick video, um, to give you a little bit of background about the new Medicare prescription plan and the payment plan for this year that we're in now, if that's okay. Next slide. Oh, can you hit hit the man, it'll play the link. Yep, thank you. Is it playing? Do I need to share? Uh-oh.
It's not playing the video.
Okay, let me see if I can share. Let me see if I can share my screen. Uh, let me see. Walk me through this real quick to go up top. Where do I share I see the dots. Let me see if I can share.
I will stop sharing my screen so you can share.
Okay. I'm just looking for the option to hit share. I see view profile, mute, eggs to start video, chat, or pin.
So it should be at the bottom. It should say share in the middle of the screen, a green box.
I'm looking.
At the very bottom, Kaliesha, where it has everything that says audio, video, participants, chat, react. Do you see share in the middle?
Spotlight hat. No.
Put your cursor over the bottom so it'll pull the row up. It'll pull the band up.
Hold on, let me make my screen a little. So, okay, I see it now. It wasn't showing me the screen wasn't showing me the whole thing. I think this is it. View. Is it this green checkbox? No, hold on. I'm sorry.
There's an arrow pointing up.
Oh, I'm so sorry, everyone.
That's okay, Kaliesha.
I see the recording button. I'm on my screen. Blur, adjust, background, choose, filter, choose. Oh, how do I share this? Let me try to move. Hold on. Wait a minute. Okay, can you see me? Oh, okay. I had to switch my screen. Okay, I got you now. Yes. I want to share this one. Can you all hear it?
No, go to advanced and select play. Play music from my computer.
You said advanced.
Uh-huh.
I told y'all I'm not with the electronics. We're gonna find it.
Kaliesha, down at the bottom where you see the
Uh-huh.
green button that says share,
Uh-huh.
click on share,
Yep.
and then look up. You'll see screens, documents, and advanced.
Yes. Screen. Oh, hold on. I see entire screen, documents in advance. Mm-mm. I see share. I'm clicking share.
Okay, something's coming up. There you go.
Okay. Can you hear it now?
No.
Okay.
You have to click on advanced when you click on share, and then you have to click on play sound from my computer.
Oh, let me hit more. Maybe it's under more. Share computer sound. Oh my goodness. Uh-oh. I'm gonna try this one more time. I hope I get it. I'm so sorry.
That's okay.
Medicare
Can
drug
you hear it
plans
now?
and buy Medicare health plans with
Still
drug
no?
coverage,
Yep, we can hear it.
including
Yeah, we can
Okay.
hear
Medicare
it.
Advantage plans. Here are 5 things I learned about the Medicare prescription payment plan that you should know too. 1. It doesn't cost you anything to participate, and participation is voluntary. 2. This payment option can help you manage your out-of-pocket Medicare Part D drug costs by spreading them across the calendar year. 3. Your payments might change every month, so you might not know what your exact bill will be ahead of time. Future payments might increase when you fill a new prescription or refill an existing prescription, because as new out-of-pocket costs get added to your monthly payment, there are fewer months left in the year to spread out your remaining payments. 4. You're most likely to benefit from this payment option if you have high drug costs earlier in the calendar year. You can start participating in this payment option at any time in the year, but starting earlier in the year, like before September, gives you more months to spread out your drug costs. 5. If you use this payment option, each month you'll continue to pay your plan premium if you have one, and you'll get a bill from your health or drug plan to pay for your prescription drugs instead of paying the pharmacy. If you want to participate in or need more information about the Medicare prescription payment plan, call your health or drug plan or visit your plan's website. You can also visit medicare.gov/prescription-payment-plan for more information on how this payment option works. This payment option might help you manage your monthly expenses, but it doesn't save you money or lower your drug costs. If you need help paying for your prescription drugs or other health costs, there are programs that might be able to help. Many people qualify for cost savings and don't even realize it. Visit medicare.gov/basics/costs/help for information about cost savings programs. This product was produced at U.S. taxpayer expense.
Okay. All right, let me unshare. All right. Everybody good? Uh-oh.
Yes.
Okay. I'm sorry.
No, that's okay. Do you want me to go back to share the rest?
Yes, ma'am. Thank you. The pressure is off. But I thought that video was very important when I saw it. I was like, oh, it's a lot going on. So let's put this in here because it explained it in a nutshell. Hold on, let's get it. Okay. And so this is just a couple of other items for the payment plan for Medicare D. Of how you break it down and how it's voluntary. You don't have to, it's not mandatory. So if you sign up for it, you can cancel it at any time. The only problem with that is it'll restart over that $2,000 deductible. later on, depending on when you fill another prescription. And you don't pay it to the pharmacy at the point of sale, you pay it to your plan. Yep. And so you can say you don't have to sign up at the beginning of the year. You can sign up in the middle of the year if you feel that that is a better for you at that time, depending on if your course of therapy may change for medications. Yep. Okay. All right, let's get to the next one. So this, I thought this chart was important. I had got this chart from a drug company, and they had broke it down a little bit just to show you some people are visual learners and needed a visual aid. And so this broke it down like if you were to start a prescription, you had to say you had a chemo drug and it was an oral oncolytic and it cost you $2,000, or if you had a diabetes medication and it was expensive, uh, or DVT drug for blood thinner, those are expensive, $500 every time you get it, right? Say you got that at the beginning of the year, um, you have the option to break that copay down, and you can break it down. When you do break it down, you don't break it down in a 3-month span. You break it down in a 12-month span, but it's between January and December. If you got a medication in like March, you only have until December to pay that. So sometimes that premium that you're paying every month for that may go up, because the shorter the months are, the more your amount will be monthly, and so you would have to budget that in. So you just have to think about what's in your budget when it comes down to signing up for a plan like this, and if it's beneficial to you, right? Um, Next slide. This slide is just it's information to show you how, if you wanted to sign up for the Medicare D plan, and different ways to sign up for it. It's very important. And then, last but not least, I want you guys to make this formal now and intimate with you now, because if you had a question about insurance that you didn't understand something, I want to make it personal with you and see if I can answer those questions. If I didn't answer it in the slide, I would be happy to answer those things with you guys right now. I think you can unmute yourself maybe if you have one.
Yes, ladies and gentlemen, I know you guys have some questions about insurance, or else you wouldn't be on here. So this is an insurance to me. Just ask her. Please come off mute, and if you have any
But I also wanted to say there is a difference between Medicare and Medicaid. I find it that a lot of people get confused
absolutely,
with those two
absolutely, yes,
insurances. Because they both start with the M and they both are federally funded, right? So you have Medicare, which is federally funded, and then you have Medicaid, which is state insurance basically, but it is a governmental insurance, but it's state. And what Medicaid does is help uh, lessen the blow of what your out of pocket would be for that 20% that Medicare does not cover for your services. Um, what else I wanted to touch? Oh, I don't know if you guys are aware of this. This is something to also think about when you're retiring. Did anybody have a question before I keep going? Okay. No.
Ms. Harrison, my name is Avis Pearson, and I did have a question. Can you clarify again about the Part D?
Okay.
You said that was voluntary. Can you explain that?
Yes. So the payment plan is voluntary. So what's important also about Medicare D is what they don't tell you when you're getting ready to retire is about the penalty. Is that what you want me to get into a little bit about that, or just?
Yes,
Okay.
please.
So there is a penalty. I can't remember if it was 3 or 5% penalty that they charge you if you don't sign up for a Medicare D plan when you're eligible. Whenever you're eligible for Medicare, you become eligible for Medicare D, as in David. And some people, they continue to work and things like that during that time. So they don't typically sign up for one of those because they already have a prescription coverage, right? And so what I strongly recommend is when you become of that age, or when you become eligible for Medicare, I strongly recommend contacting Medicare at 1-800-Medicare to find out what your penalty potentially could be or if it benefits you better to sign up now for a plan or wait till later when you're getting ready to retire. But I strongly recommend finding out what that penalty would be depending on when you're thinking about retiring. Did that answer?
Yeah, and so
Okay.
you mentioned that when signing up, you can drop it at any time. So
So
would it be beneficial to, when you are at that age, to go ahead and sign up for it? And then, like, how soon can you drop it?
So let me clarify that when I meant by voluntary, I meant by the payment plan being voluntary, not the insurance, right? So there are special enrollment periods for signing up for a Medicare D plan. So the main time to sign up for it, when they have open enrollment time, is usually between October and December. However, your first chance becomes when you eligible for Medicaid, when Social Security sends you that red, white, and blue card out, right? And then
Okay.
you have a couple months in between there. So say your birthday's in December or your birthday's in January and it's after the enrollment period. That is your enrollment period because now you become active. That's your first enrollment period for Medicare D. You become eligible for a Medicare D plan and you have a couple months to make that decision. Now, once you pick a plan, you're typically stuck with that plan until the next enrollment time, right? Unless you have a life-changing moment that you're eligible. Say you're eligible later on in the year for Medicaid. You're eligible for a special enrollment period. Say you move out of state, move to a different state. Say you lived in New York and then you moved down here to DC. You're eligible for an enrollment period, so you could pick a different plan at that time because the plans vary by your zip code depending on where you live. Did I get it?
Yes, thank
Okay,
you. Thank
you're
you.
welcome.
Hi, this
Yeah.
is Vanetta Turner, and I did
Yes,
have
ma'am.
another question in reference to the difference between Medicare and Medicaid.
hmm
Um, so I know you said that was state for Medicaid, but isn't there also a income? Isn't it
There
income
is an income
needed?
requirement. Yes, they have different states in it. So Medicaid is broad. They have about, I want to say, 3 or 4 different programs. You got straight Medicaid, where you can qualify for the full-blown program, where you get fee for service, where you get transportation, you get paying your Medicare premiums, all these things. You got Slim B, you got QMB, you have it's one more. I can't think of it right now. I think it varies by state. But so I don't want to lose my thought and I don't want to babble and go off target here.
That's okay. I
So
also wanted to know the amount. Do you know what the
it varies by
this year?
state. It
Oh,
varies by
okay.
state. So if
All
you live
right.
in DC, the income limit is higher. If you live in
Okay.
Maryland, it's very low,
Okay.
right? But even if they deny, so I want to say Maryland. Sometimes I feel like it varies and it changes. I want to say it's like 1,000 or 1,100 a month or something like that. We just really get into it. But
Mm-hmm.
even if they deny you for Medicaid,
Mm-hmm.
they sometimes give you this thing called a spin down. They deny you, but they give you an option to itemize to get coverage. And so what I mean by that is they may say, hey, you're over income. You could be over income by $50. And then they give you this obscene amount to say you have to meet $3,000 to $5,000 in medical benefits before we can pay. And you got to do it within this time frame. They usually give you a 6-month time frame to do those things. Say you went and applied in January, they give you to January to June to accumulate all of this medical expense to be eligible, and they might just go ahead and pay. Then they'll retro and pay those claims back later.
Okay.
But Medicaid goes by state. So if you're in DC, you get DC Medicaid. If you're in Maryland, you get Maryland Medicaid. If you're in Virginia, you get Virginia Medicaid, and so on and so forth with that. But
I
Medicare
understand.
is the same wherever it goes, right?
Okay.
So you got traditional Medicare, then you got the Medicare Advantage plans.
Got it. Thank you.
You're
Okay.
welcome.
Yeah. And Kaliesha,
Yes.
okay, this is Glinda. Right,
Yes.
can you talk a little bit about there are 2 things. Number one, like the Advantage plans, which is the Medicare C, because
Yes.
that provides coverage for your dental and vision. Because I
Yes.
think, right, because what happens is a lot of times when you just have just regular Medicare, A and B, it doesn't, no longer will it cover your dental and vision. So you have to get that Medicare C. And then I think you were also talking about the Medicare D. That's the prescription coverage, because what I'm finding with a lot of patients, they just have Medicare A and B, which covers your outpatient services and inpatient, but they don't have the Medicare D.
Yep. They
So
forget
when they
about the
get,
D.
right, so when you have these high cost drugs, they don't have coverage. So then you have to try, that's where Kaliesha comes in, they're trying to get copay assistance. And then the other thing, if you can talk about people who maybe are not ready for retirement, but they are commercial insurance. And when we say commercial insurance, you're talking about your Aetna, your Blue Cross, your Blue Shield, and sometimes their copays or out of pocket may be high. Can you talk about some of the options that they may have? Because some don't realize that manufacturers have a copay. There are other, like Good RX. So if you can
Yep.
talk about that, right?
Okay. Got a lot of homework. Let me get it right down to you. So, first let me go to the Medicare Advantage, right? So the Medicare Advantage plan is also known as Medicare Plan C. Those are considered all-inclusive plans. That's when you get A, B, and D rolled up into a plan together. Now, A is hospital, B is medical, the D is prescription, and the C is just because you got A, B, and D in one, and that's just the name that they gave them, right? So,
Excuse me, can you repeat that, please?
yes, ma'am.
Thank you.
Medicare A is for hospital coverage. Medicare B, as in boy, is for medical coverage. That's outpatient. When you go see the doctor, and you pay your co-insurance with that. You got D as in David, which is prescription. So there is a chance to sign up for a Medicare Advantage plan when you switch over from a traditional Medicare. That's that red, white, and blue card. Always keep your red, white, and blue card. Never get that away. Even if you sign up for a Medicare Advantage plan, always keep that red, white, and blue card because you're going to need it later or at any time. So, the A, B, and D together is called Medicare C or Medicare Advantage. You can sign up for one of these plans. Most of them have dental and vision. Be careful when you're signing up for them because all of them do not carry the same coverage. So, but most of them, people sign up for them because they have the option to have dental and vision, which is very important when you're older and you may have to go through different therapies and things like that. So, when you retire. Um, but also one thing I wanted to tell you all, and I didn't think that this was possible, but you do pay a premium. So when you retire out, you sign up with Social Security when you sign up for Medicare B. You're paying a premium for that Medicare B, for your Medicare. However, when you do switch over to the Advantage plan, you're still responsible for that premium that you pay for traditional Medicare. And if the plan that you pick for Medicare Advantage as a C as in cat, if you pick that plan, you're still responsible for whatever premium that is. Folks don't usually know that, but if that plan says you get a premium, then you have two premiums.
Oh, wow.
Yeah. And I know this for sure. I just did my mom's, and she retired before she turned 65, and a couple years ago, and then she ended up paying this $700 or so for her retirement plan, her commercial coverage, right? She's paying $700 a month all the way till she turns 65 to keep that coverage so that she can be on all these medications she's on. Some of them expensive, so she can keep her copay cards. That's what Glenda was referring to when they're saying when you have a commercial payer, you on certain brand medications, the manufacturer has coupons, and those coupons could consist of making your copay from $100 down to maybe 0 or 5 or 25, depending on the coverage of that particular card. Um, I don't want to miss what you was telling me to do, Glenda. I wrote a couple things down. I want to make sure I'm answering everything you need, baby.
No, that's fine. That's fine. You're doing good.
Okay. But yeah, so the commercial plans, I love them. I love them dearly. Because they help out. And even if you have to use my mother for example, she had commercial and she had the Part D, right? So she had both of these things. And so she was able to get around a couple things when she had them too. So her copays were just basically zero for a lot of things. I don't know how that happened for certain medications. I don't know. But she was able to get more coverage when she had her commercial versus when she had the Medicare D plan. She had a question. Miss Mary?
Yes, thank you.
Mhm.
Can you talk about the federal employee program, the medical prescription drug program, MPDP? I think that came into being last year, and they actually just moved some of us into that plan. Can you talk about that plan?
You said
It
MP.
the initials are M like Mary, P like Paul, D like David, P like Paul, and it's the Medicare Prescription Drug Program.
Oh, yes. Oh, yeah, yeah, yeah. Okay. So that's considered Medicare D as in David.
But
So
it's
do you
under
want to?
Blue Cross. It's under Blue Cross. Actually, I have Blue
So
Cross
did you? So
retired.
your Medicare program, they have them too. So is that the Medicare Advantage plan that's through your work because they have those? You can sign up through that one, or you can sign up through traditional Medicare.
Well, let me
Is
tell
that
you how it happened
okay?
for me. I am retired,
Mm-hmm.
and I have, like your mother, I still have my Blue Cross Blue Shield from my retirement,
Mm-hmm.
and I am also on Medicare.
Okay.
For some reason, Blue Cross started a new Medicare prescription drug program last year, and they automatically put me in that. And I'm trying to figure out how to opt out of that now because I understand from the pharmacist, if you are in this Blue Cross program, if you're in this Medicare prescription program,
Mm-hmm.
then, and you kind of mentioned something about this at the top,
The payment
you are,
plan. Mm-hmm.
you are not eligible for certain drugs. For example, if there are new drugs that are being prescribed, your co-payments may be high. Under Blue Cross Blue Shield, their prescription program, they would allow you to use those manufacturer benefits, but Medicare doesn't.
Correct.
Okay.
That's
Correct, because it's
correct.
considered federally funded. So I will say it also depends on your formulary too. So every plan has a specific formulary for medications. So when you're picking a plan, and unfortunately they pick yours for you. So when you're picking a plan, it's very important to sit down with a rep and say, hey, this is my drug list. These are the medications that I'm particularly on. Which plan best suits me? And so you can, when you have the plans with your job, sometimes you go into those retirement plans. Sometimes if you opt out of it, you don't have the option to go back in it. Right? And that's what some people get afraid of sometimes. And or you can, if you're comfortable and if you're able to do some research with it, you can contact 1-800 Medicare and you can go through a list with them and go through all of their plans for which they have. And then you can make an executive decision to choose whether you want to stay with that one or you want to switch. Does that make sense?
It does make sense, and at this point, I know I want to switch. I don't have a large list of drugs today, but that might happen in the future. And I have a husband who has a lot of medical issues, and I've
Mhm.
seen how that could have impacted him.
Okay.
I actually wanted to move him into that, and the pharmacist said, no, leave him where he is.
Hmm.
So anyway, I was just wanting to know if you had any experience with that.
Yes. So, and that's something I would do like on a case by case, right? So, without knowing all your benefits, but know your benefits, I still even recommend you contacting Medicare, 1-800 Medicare, or if you're tech savvy, plug in your information into the Medicare.gov website and see what pops up. Because not only do prescription plans pop up, but you can also talk about Advantage plans.
Hmm. Okay.
So
Thanks.
I just for consult, strongly recommend a consult. And if you, I would be willing, I would be willing to assist you with questions in the background if you need it when you're speaking with Medicare. For sometimes some of us don't think about the questions to ask when picking plans when you're talking to a rep, especially if you got a seasoned one when you're talking to Medicare.
Mm-hmm.
If you want to my information later on offline or have some additional questions later, I think it's okay. We can talk.
Okay, thanks.
Yeah. Frederica's?
Yeah, you can say
say.
Terry. It's fine.
Thank you.
It's nowhere in there, but it's Terry.
Okay.
I have a question about retiring. And I'm trying to lower my hand, but yeah, retiring.
Okay.
So if you were to retire, you have to be like how you have to be to get Medicaid.
So Medicare, you're required to be 65.
Okay.
Right? Otherwise, if you retire beforehand, you run into paying a higher premium for things before you go into that 65 age.
Oh, so if I were to, I'm under 65, I'm under 60. So, but eligible to retire and might have to or might do it or whatever. I should just keep my current commercial insurance and
Yeah,
just
you're gonna
worry
have
about
to.
the
Yep.
okay.
You're gonna have to because you won't be eligible for Medicare. So there's a couple of times when you're eligible for Medicare when you're not of age. The only other time that you're eligible for it is if you've been on disability for 2 years, then you would qualify for Medicare.
Okay.
Right. And then you already have the Medicare portion, but you won't be able to, you'll get penalized for those supplemental plans like the Medigap plans, right? Like so they don't have the plan Fs anymore. They got plan G. That's my favorite out of the new plans they got, that all the alphabets. I call them the alphabet plans, the supplementals. So plan G covers everything but the Medicare deductible at the beginning of the year, but they cover the 20% after everything else. But what I do, I always, whenever anybody's thinking about retiring, before you make a drastic decision, especially depending on your age, I strongly recommend sitting down with the HR rep.
Oh,
at your
HR is
employment.
bump. They not even. They turned their phones
They not
off.
what they used to be.
They turned their phones off right now.
Oh, okay. I
They
bet
bumped.
you they did. They overwhelmed.
Yeah.
Right now. I'm
Yeah.
sorry.
Yeah.
But I strongly recommend, because they can tell you what the premiums would be for if you retired now for work and how long, how the coverage works. So to see if that's affordable with whatever your income is going to be when you go out, it's important to know how much you're going to be covering in insurance when you go out, when you're under 65, if that makes sense. Anybody else? I guess I'm doing all right.
Hi, my name is Ramona.
Yes, ma'am.
I had a question. So you were talking about the Medicare Part D, right?
Yes.
And so I kind of just assumed, or had to assume, care for my mom. She never did a Part D.
Okay.
Only did an A and a B, and they were speaking to me about the
penalty,
and it's been over 10 years. Any idea what that's going to look like? Yeah, I don't like how your face looks.
10 years. I mean, it's going. I don't know what her economic status is, but it's definitely going to be some funding. So the only way to find out typically is to call Medicare.
Okay. Okay. Yeah, I just found this out a couple of weeks ago because I'm not well versed in it.
Yeah. So the best
and the
route.
rep told me on the phone. Okay.
Yeah. Sorry.
It's okay. It's okay. Thank you.
You're welcome. But depending also, what she's eligible for, Medicaid is always an option too. Medicare also can help cut the cost of the premium, depending on her economic status, of course, or anyone's economic status. Medicare can help pay the Medicare premiums, right?
Okay.
So if she had Medicaid, excuse me, it can cut the cost. They call it a Medicare savings plan. It has multiple names for it. I'm traditional. I'm calling it Medicare and I'm calling it Medicaid.
Okay.
And I'm calling it LIS, low income subsidy plans too. Because when you get Medicaid, it also helps lower your Medicare D prescription costs If you have like a high price drug, I'm going a little off for you. I'm sorry.
Okay.
But I want to make sure that information got out to everybody else. Always check in to see if you qualify for the LIS, which is called Low Income Subsidy Plan, when you have a Medicare D plan. So your copays could be extremely high, but depending on your income, you may qualify for a reduced copay for your prescriptions. I just wanted to
Okay.
throw that out there because I didn't say that. I'm sorry.
Okay. All right. Thank you.
You're welcome. But did I answer your question to the best of my ability?
Yes, you did.
Okay. Okay. All right. Anybody else?
My name's Carolyn Harvey, and the question I guess I have is the Medicare Advantage, and that's considered a PPO, right? Well, for United Healthcare, Medicare Advantage, it's considered a PPO.
Well, they have a bunch of different ones, but
okay. But this is through my job, and that's what they offer. Okay. And I looked into the possibility of getting the D, but in order to get the D, I would have to come out of the plan that was provided for my job to do that. And in talking with the number of people, it just didn't make sense for me to do that. I mean, economically, it didn't make sense for me to do that.
I got a question. Because I know that you have to come out of the plan if it's a supplemental. But who's told you had to come out of the plan to get on a Medicare D plan?
At United Healthcare.
United Health. So you want to go into a United, you're in United Healthcare now?
Yeah, I'm in United Healthcare Medicare Advantage plan through my job.
Okay.
So that's like a group plan through the job.
Right. And that plan also has prescription coverage under it? Or just
I do get some prescription coverage, but I think the script's a little bit higher than some of the other plans.
I'm sorry, I'm thinking.
Okay.
Because some plans you don't have to do that with, but it sounds like this is something specific to your job, because some retirement plans, like I can use my mother for example. I'm sorry. I got to go for what I know. She was able to keep her Medicare D plan that I signed her up for before she even signed up for the Medicare Advantage plan with her job.
Okay. Well, when I retired, this is what was offered.
That's the retirement plan.
As the retirement plan.
And you can't get partial. Right.
No.
Right.
No.
Okay.
No. So, but then speaking with the number of people, they said that, it would behoove me to stay there, because if I went outside and got a different Medicare plan, that my cost would be a lot different and more.
So
am on some expensive
medication.
Drugs. Yes, Lord. I was like, oh my God. But most of the time the most I pay is like $28 for them.
Oh, that's good. Okay.
So when I see a $500 and some dollar, what it costs and what I pay, I guess I think I'm blessed in comparison to some other people I know.
Okay, yeah. So for you, I would probably have to do a itemized thing, right? So I will have to lay out everything you paying and everything you're getting from the United Healthcare plan, and then I would still do research. I would call Medicare. They can't. It's okay to call. They don't have to send you over. You can call and inquire about what the coverage and those things will have in that.
Okay.
So and that means that how much it will cost you. How much it doesn't hurt to check up.
Okay.
So sometimes people stay in plans and they don't know that there's something else better out there for them. Right.
Okay.
So it's okay to inquire about it. It doesn't mean that you're signing up for it. You just want to know your options and see if that might be worth doing it.
Right.
Right.
Okay. Okay. Thank you.
You're welcome. anything else we want to hit today or tonight? I'm having fun with y'all. I hope I'm being informative with you.
You're very informative. Yeah. I'm learning some things myself.
Mm-hmm. But I strongly recommend anybody that thinks they're going to retire or thinking about any of those things, always go early. So if you can go early before you turn 65, investigate and inquire about what everything is. Know your expiring dates, right? Know when your limits are, like when you have your grace period dates. That's what I mean by expiring dates. Know your grace period dates. Know your grace period dates for the Medigap plans when you can sign up for that supplemental. Just know your dates when you have those rest periods that give you time to make a decision of should I get this now? So I just want you to inquire, always inquire.
Hey, Kaliesha, hi, this
Yes.
Barbara.
Yes, ma'am.
Just listening to everything that you're talking about, and I don't know, where I'm working,
Okay.
they're also offering the Vera, and there's a lot of people, not me, but there are a lot of other people that are thinking about it, and they just have a lot of questions about it.
Mm-hmm.
Um, I guess I could have taken this offline. Would you have a problem if I had one or two people contact you
No,
so that
ma'am.
they could understand their benefits that they would get if they decide to do the early retirement?
Yep, I'm okay with that. I'm
Okay.
about advocating for y'all.
Okay.
Anybody that needs it, because it's rare out here and it's hard to find. So I'm about advocating, so I don't mind.
No, can we talk about that one? Hi, you're doing an excellent job. I actually work for Medicare and Medicaid,
Oh, thank you.
but
Oh, okay. Did I say
and
something wrong? Wait a minute.
no, no, no,
I'm
no.
just joking.
No, but the agency, because you guys know there are a few
CMS.
agencies that has just been offered early outs,
Mm-hmm.
and
Right,
a
right.
lot of people have to figure out in a week, some
Mm-hmm.
on Monday, if they're going to retire.
Mm-hmm.
And that's a lot of challenges to try to figure out when you didn't have this as a plan.
Mm-hmm.
With that said, I don't know what the lady who just asked this question, but and everybody's numbers are different, everybody's situations is different. But regarding most people with their employers, do you know regarding federal insurance, if you keep it, not keep it, or just take Medicare and Medicaid, or what is your suggestion? And also, if you need help, I'm willing to work on weekends to learn this because this is a passion of mine. Because I also help my mom and other
Mm-hmm.
family members on this healthcare maze, which is basically, if y'all don't see what's going on, it's privatizing healthcare. They want to make it so that the billionaires and millionaires, this Medicare Advantage is all about private insurance.
Mm-hmm. Mm-hmm.
Exactly. Period. Regular
Period.
Medicare was perfectly fine. People pay into it. Medicaid, like she said, each state is different. But I can tell you now what they're working on. They're working on, if you have Medicaid, that you're going to have to work for Medicaid.
Mm-hmm.
DC, Maryland, Virginia, we're blessed because other states don't have what we have.
Mm-hmm.
Period. But I would like to know your thoughts on, if we always at this retirement thing, and a lot of us have to figure out, like I said, in a week, what we
Mm-hmm.
should do, which is just daunting. A lot of people are losing their jobs.
Right.
I don't know if this is a separate call or if you can follow up, but that is a great question.
Okay. So what to do about within a week?
Yeah.
Um, so everybody's case is different because everybody's age is different and everybody's situation is different. Um,
Yeah, I wasn't sure what the lady's question was regarding that.
so,
And
so
for everyone else with a very,
she's under, I believe she was under the age limit, right?
yeah.
I think.
Are you
So
talking about me? You talking about me?
No, I think you talk about me, Terry.
Oh, for
Yeah.
real?
Yes.
Okay,
Yeah,
okay, go ahead.
I'm under 60, and yeah, I
mhm.
may have to retire too.
Okay.
And so I was just trying to, like the lady said, you have a short amount of time to make decisions, one, and two, you can't really get any answers from HR because they're
Mm-hmm.
bombarded. So
So one thing also to consider is, I don't know if you guys have financial advisors and things like that for those that might be at the cuspice of things and things like that, or have a savings plan or anything like that. I would recommend also, if you could, speaking with a financial advisor to see what your options are with your funding, your retirement money and things like that. Or if they're giving you a buyout, if they, I would look into those things to see if you can maneuver. So depending on, for those that are under the age, and I know that it's a long shot because, again, to qualify for Medicare, you have to be on, if you're under the age, you have to be on disability for 2 years. I don't know if any of your circumstances will push you in that avenue or direction to go and start applying for disability. Not sure. But I would also, I definitely recommend speaking to a financial advisor about your,
Well,
like your
well,
401k and things like that to help
well,
tie you on.
Kaliesha, I guess what the situation is here, and I believe what Kia is talking about with government workers now, they're
Mm-hmm.
offering, everybody's not like me, I'm not eligible. So they're getting ready to offer the voluntary early
Mm-hmm.
retirement,
Right. Because
right?
my
And
husband's
so
considering it. And I was like, no.
right. So there's a lot of
So,
people thinking about it. And as far as, people being able to help them, like the other young lady said, they're bombarded. HR is like bombarded, and everybody's running around like a chicken with their head cut off.
mm-hmm.
Now, as far as the financial, there are different financial calculators out there. There are different forms to kind of try to figure out what it would be your retirement. And also, there's RIF forms out there. Now, I don't know if everybody,
Mm-hmm.
if anybody here else at the government, there's RIF
Mm-hmm.
forms out there that we've been handed. But as far as insurance is concerned, with the early, just the insurance part, not the financial part, with
Right.
the early retirement, are you well versed in that you
So,
get actually, if someone, hypothetically, somebody 55, 25 years, I know it has to be
mm-hmm.
85 years or something like that, so they're off, and I'm giving you a coworker scenario only because she
Right.
talks all the time. So she's off 2 years by
Mm-hmm.
retirement, right? So
Mm-hmm.
she's thinking about doing it, but insurance wise, I guess I'm asking, how do you figure that out?
So the the insurance premiums are going to come from the HR, the retirement portion of
Mm-hmm.
the job. So their premium's going to come in from there. Each job is different in how much that premium is going to cost you when you come out, or whether you want to go to the marketplace and buy insurance.
Okay.
So marketplace, yeah, I mean it's there, it does its job. But the only thing I get scared about the marketplace is depending on your health, it doesn't work for all. It doesn't cover a lot of things. I call it the discount insurance, almost like a when you have a prescription, like Good RX and all those things. I call them the discount card,
For the
if that
marketplace.
makes sense.
Hmm.
That's just my name for it to simplify it and make it easy. It does its
Right.
job. Sometimes the premiums are good, but then the coverage doesn't give you enough, depending on what your health may go into or what your health is already into. But marketplace is always an option if you're thinking of doing that and you got to go out early. And then depending on how much the premium is from your provider, from your job,
Hmm.
will determine. I can't tell you what the premium is because I'm not sure, but I can also inquire or recommend looking into the marketplace and see what those premiums look like.
Okay, so what you're, just so I can reiterate, so what you're saying is, first try to find out what your premium is. I'm the government. First, try to find out what your premium would be with your government job, and then see what the
Mm,
marketplace is. Because more than likely, and everybody, just correct me if I'm wrong, because I'm trying to understand this myself too, because I
mm,
don't understand the government.
okay.
So if you're doing the early retirement, and we have premiums now that you have to pay. So if the premium, say Blue Cross Blue Shield, the premium is the same. If you go out early retirement, do they match it just like we're doing now, or is that discounted? Does anybody know?
They match it, but you still have to pay the 2%, just like if you just had like a regular job. So how it's coming out of our pay now, when
Okay.
you still got to pay something, but
Hmm.
kind of what you're paying now is kind of going to be what it is, but it's an additional 2%. Now, I like that idea. What you're saying is to kind of, all of us scenarios are different, to go to marketplace.gov and try to fudge numbers like
if then, maybe this, because we're all in the same boat trying to play around. And we don't know, one, if insurance going to be here, so Security going to here in 5, 10 more years the way they're going. And so what's the max that we can do now? And try to see the numbers. But I like that idea of seeing what you're paying now. I think I talked to someone on my end because I'm all in the same boat. It's 2% of what my insurance, because I have Aetna up my federal right now. I retire out early, which is what I'm really thinking, because I don't think I can deal with this another 4 or 5 years. And I'll be happy to come work with you and help others with insurance. I think it's 2%. I just asked a retirement specialist that same question, but I do like the idea of playing around because everybody's numbers is different.
Right.
Everybody might have, you might have kids or a husband that's different that you need to pay for XYZ.
Right.
So, but it is marketplace.gov. Then I think from there it takes you to, if you live in DC, it takes you to the DC information. If you live in Maryland, it takes you to the Maryland. So that's the one place to start.
Yeah. Because, and like I said earlier, things change, premiums changes every year. Insurance has changed every year. But I will say that when my mother went out early, she's 67 now, I think. Sorry. My mom went out early. And so when she went out early, she went from paying $200 to $700 a month until she turned 65.
Whoa.
Again, everybody's is different. And my mother is retired from the federal government because she had 20 years in the federal government, and she had a state because she worked for DC jails. So she went from paying that to paying almost $700 a month until she became 65. So I would definitely want to know what that brochure looked like for the premiums, for that, what that true 2% really is, Miss Kia, and if they're changing it because of what's going on now, if they're trying to lower the pricing for it too.
Yeah, that's true. But I did hear some people on the marketplace, they were paying about 5, 6.
Yeah. But I'm not a fan of the marketplace. But if you don't have any option, it's there.
Yeah.
Right?
Yeah.
But I'm just saying, everybody's situation and financial situation is different. And so you're going to have to put those two and two together. But also find out, because sometimes with those retirement plans from work, sometimes once you leave it, you can't get back into it. So you have to be very careful about what decision you make at that time.
Correct. I guess we all have made it clear, whatever we decide, it's going to be more money when we leave.
Yes, ma'am. It's definitely going to be more money. Yep. Anybody else? Sorry. Is that all the questions for tonight? Do we need to make this another night too?
It almost sounds like Kaliesha, you and Kia. I don't know. We need to have another.
Listen,
there's some
we
government workers on here. I'm telling y'all, like this. I'm texting a couple of people now saying y'all should have got on here because y'all have the questions that need to be answered. Yeah, and it's.
So what I would do, because me and Miss Glenda are really cool peeps, and I'm in the same predicament as what I'm hearing others with this trying to determine federal government, because I'm asking the same questions. Once I find out, and I'm hearing what you guys are asking, and I found out the answers, I will definitely share it with Miss Glenda so she can pass it on to this group, whether it's an email or follow up, because I know a lot of people are in the same predicament. And I will be asking these questions. My agency, it's over 80,000 people. Yeah. It's only 10 people in HR. I would not want to be an HR person right now.
Wow.
It's insane. And what they're doing though is having office hours, trying to answer all the questions as they can. And I'll ask these healthcare questions and see what we get. And
that's very important. Yeah.
Because I'm in the same boat. So I will find out what I can and report back.
Yeah, I'm curious. I want to know that 2%. I want to know what they really doing. And I want to know if it's per agency or how they doing it. I want to know. Yeah. I do. Because that also helps me do my job. So.
Well,
No, this has been very enlightening. And if my mother was still alive, it would have been very enlightening because I went round robin with insurance when she was alive. So, but this has been awesome, and I'm hoping that everyone got something out of it. But I Kia and Kaliesha, I probably will be reaching out to both of you. Not for me, because I can't do nothing with me, but for, but because I don't have the age on it. Well, I got the age, but I don't have the year, so it doesn't matter for me, right? So I'm just in the waiting boat. But I will, hopefully, and and let me just be honest, right? Your time is important. If you have information to share, with someone, consultation fees. I mean, I'm not I'm sitting here and I don't want to drain you too, right? But you know that there are a lot of people out there that need the information. I'm talking to you too, Kia. And if you have the information and you want to set up, some things, just let us know.
No, will do. I understand. This is a passion of mine as well. So I understand because being in it, the healthcare maze is ridiculous. It's sad. It's ridiculous. I started into this. My grandmother years ago was sick in North Carolina, and that's how I got into it. I just kind of morphed into it. And so now, even for us who we didn't plan, we can paint a perfect picture, but we can't predict the weather. And I'm telling my coworkers, I'm telling my coworkers, listen, whether we wanted to retire to this year, tomorrow, we're going to have to retire at some point. And everything is temporary, and you have to figure out how to pivot, but pivot for you, even though this is not how you planned it. And so I'm looking at it as maybe God is like, you done enough. What's your second life? And so the more and more I'm praying, second life is sounding like I need to help people with Medicare, Medicaid, and insurance. So you guys are just confirming for me where I should go next.
Amen.
So thank you for this call. I would definitely find out tomorrow. What if I find out? Even if I don't find out enough, I'll send Glenda an email and they're still following up because they are working as hard as they can.
Yeah.
Like you said, I can only imagine. And Kaliesha, we just want to thank you very much.
Yes.
Very enlightening, very informative, and it sounds to me like we may need a part
another one. Yes, I was going to say the same
with
thing.
Kaliesha and
Miss Kia, yes, ma'am.
Right, and then I think we might be able to identify you like HR person, but it sounds like this conversation.
I have an HR person.
Oh, perfect.
My sister-in-law works in HR. I can
with
check with her and see
government?
if she ever. Well, not with the government, but she worked in PG.
Right.
But I mean, but she's an option if to give information.
No, that's great. No,
I'm throwing her out there.
No, and it's appreciated, and it is a resource that's needed because it does sound like this conversation needs to continue, and especially and just to let everyone who's impacted by with the federal government workers that's impacted, we're definitely praying anything that we can do to help, and because we know you all are right, y'all are like right on the front line with everything that's going on. You all are being targeted directly, and we know ultimately the whole country will be impacted by this as well. But we know you all are right on the in the bullseye. So, and I can't begin to imagine the amount of stress and just everything that you're dealing with. So just want you all to know that there are a lot of people just praying for each and every one of you because we've never seen anything like what we're seeing now.
Can I jump in real quick? I just want to thank everybody, Glenda and the speaker and facilitators and everything. This has been very, very informative. And I had a question about financial planners. Are there any that aren't selling something? Because I am skeptical. If you're selling shoes, then you're quite naturally going to say your shoes are the best.
Are the
But
best.
in reality, is it the best for me? So I have that problem. I need one. I'd like to have one, but everybody is selling something, and I'm just skeptical about, are you really going to provide me with the best for me, or are you going to provide me with what you're selling? Does that make sense?
It does.
Yes.
Absolutely.
It does.
Absolutely.
So, well, I work with Morgan Stanley. That's why I utilize, and my sister actually works for them, and so I have a good relationship with them back and forth. And they never try to up or undersell me in any kind of way with the
Right.
with the group that we have, with the financial advisors that she actually has. And they're pretty good, and they're straightforward with you. I
What was
just
that again? Who's
Morgan
Stanley?
Stanley.
Morgan Stanley. Yeah.
Okay.
Morgan Stanley. Yep.
All right. Thank you.
Yeah, because we Terry, we can talk offline. I can refer you to my contact, my person at Morgan Stanley. And I agree with Kaliesha. Yeah, I'm very pleased. Yeah.
Okay, great. Thanks.
You might want to also look at AARP. They have some free services like some
Oh,
financial
that's right. That's right.
as well. So they have a lot that's available for people.
Okay, I'm a member. Okay, thanks.
Right. Pull out that AARP card, Terry.
Right. And pull out some of these magazines and stop laying them on the table. Read them.
Stop throwing them envelopes away when they come home.
Right.
They got information for you.
Okay. All right. Well, again, Kaliesha, thank you very much. And we thank everyone for attending. We do not take this for granted, and I think everyone may need to stay tuned for a part 2.
Yes.
For sure.
Yeah.
It's been a blessing. Thanks.
Thank you. Thank you.
Yeah.
Very good presentation.
Okay, thank you. Well, Angie, if you want to close us out.
Yeah, absolutely. Thank everyone so much for sitting in on this needed discussion. We thank our speaker, Ms. Kaliesha, and any input from Ms. Kia and everyone else. It was a informative discussion. I think this is a seed that will lead to more talks like this. Prayerfully, eventually some type of roadmap will be established where people can have a guideline to go cipher through all the madness that's going on now, unfortunately. So this video is recorded and it will be on our CCRC YouTube page. We're working towards having a Zoom series providing different information for the community. We definitely love to have the speaker come back, and also Ms. Kia, as mentioned, and do another talk. It's so needed right now. So we want to thank everyone so much. And if you want to learn more about our organization, Cancer Connection Resource Center, you can go to ccrcforme.org. If you'd like to donate, we appreciate it. Every dollar goes to helping people in need that are dealing with cancer and in active treatment, any type of cancer. So we appreciate y'all sitting in on this Zoom, and y'all have a blessed evening, and we'll definitely let you know when we're doing our next event.